Hello, my name is Michelle Moser. I'm a clinical liaison for Revelation Pharma, and today we're going to talk about coronavirus, specifically long COVID, long vax, and low-dose naltrexone, as well as the latest research. Thanks for joining me. Just want to start off with, we're going to talk a lot about medications and even therapies, even protocols that are not necessarily approved by the FDA, some of which are, but many are not. And we're also going to talk a lot about compounded medications. And as always, please seek medical advice because this is not for any type of diagnosis. This is for informational purposes only. We're going to talk about quite a bit of the symptoms associated with long COVID. What are some of the traditional medications utilized to control the symptoms of long COVID? What are the precautions that can be taken, as well as some of the follow-up that can be done to make for successful patient outcomes? So unfortunately, the symptom list associated with long COVID is pretty generalized. It can be applied to a wide variety of disease states or even acute disease states. Brain fog, loss of concentration, where you just don't feel like you're all there, short-term and long-term memory issues, as well as headaches, difficulty sleeping, some peripheral numbness. So whether it's in your feet or in your hands, kind of that prickly pins and needles feelings, dizziness, confusion. And that confusion is sometimes associated with delirium or dementia in older populations. And then some people even have difficulty moving their muscles. They have difficulty with mobility that they didn't have before either the vaccination or an acute condition associated with a positive long COVID or a positive COVID test. And of course, insulin resistance. That's something that we learned really early on with COVID disease, is that that virus will sometimes trigger changes in beta cell function, which can lead to insulin resistance. Well, what's the difference between long COVID and long vax? Well, usually long COVID, as is with long vax, the symptoms persist for months, long past any of the initial acute disease. So whether someone has a positive test and that those symptoms usually last for around 7 to 14 days, beyond that, where the lingering issues with muscle aches, headaches, not being able to sleep, brain fog, as well as the pins and needles, sometimes stays for months. We've even heard about anosmia, where people just lose their sense of taste and smell. And of course, the presence of insulin resistance that wasn't there to begin with. Now, with long vax, someone may not have necessarily had a positive COVID test, but these symptoms can show up in those individuals who had the mRNA vaccine, and especially with several boosters. The symptom list is pretty similar, but I have seen in the literature that more peripheral neuropathy is associated with the long vax more so than with long COVID. But what's very interesting is that a lot of times these chronic symptoms are showing up in younger people who had maybe a positive COVID test, had acute disease, but those symptoms were really mild. Maybe they thought it was just kind of a generalized cold, maybe moderate symptoms, but nowhere did they require respiratory care or go into the hospital or even into intensive care. And they certainly didn't need respiratory care, beyond what we have seen with the ventilator necessity. So it's very interesting that the severity of the disease does not dictate whether or not you're going to come up with long COVID. That is absolutely perplexing. But there's also other studies out there that are estimating that over 65 million people worldwide have symptoms associated with what we're now calling long COVID. Now they're thinking that actually there's many, many more people that have a lot of these symptoms, but we've not been able to identify them because with home tests being so readily available and even free to the US population, a lot of people were testing at home. They may have tested positive, but they didn't report that to the local health department, the CDC, or even their provider. So with those rapid home tests, we've seen that perhaps this idea and chronic condition behind long COVID may be much more prevalent than what we're actually seeing in the studies. Long vax has a long list of symptoms that are also associated with similar autoimmune disease like fibromyalgia, chronic fatigue syndrome, but also we see a lot of neuropathy and even tinnitus, which is unfortunate because we don't have good therapies that can help initially with that, at least not that are commercially available. With long COVID illness, there tends to be sometimes damage to lungs, the heart, nervous system, kidneys, liver, and other organs. Mental health seems to be an issue as well. And of course, there's a long issue with just grief and loss, especially all the stress that we've accumulated over the last 4 years. But whether that's associated with unresolved pain and fatigue, or now what is being labeled as PTSD, even PTSD having fallen with a visit to the ICU. So what is common in all of this are the spike proteins that are found on the virus molecule. So anytime that we can reduce those spike proteins, we're going to decrease the intensity and perhaps the duration of long COVID. But those spike proteins have been shown to also reduce the risk of some cancers, because we're also seeing, what's interesting is more cancers popping up over the last 4 years, especially in younger people. So what can we do now, and perhaps even change with lifestyle, that we all have the ability to take a hold of? So let's see what we can do with that. So one of the ideas is to take a look at intermittent fasting, whether that is day-to-day fasting or just time duration during a 24-hour period, which is called time-restricted eating. So some people may go anywhere from 1 to 8 hours in fasting, or up to 16 to 24 hours. Some people will even fast for several days, and then they will reintroduce some slow refeeding, but they're very strategic about what foods they're actually using when they're reintroducing their foods. Of course, you still take in water, tea, coffee, but nothing in those products. So we're not adding creamers, we're not adding sugars or anything like that. That would actually break the fast. But what we do know is that fasting or time-restricted eating does not activate the starvation metabolic pathways. And in some ways, it actually helps to enhance the loss of weight and the loss of those natural cells that are dying off and changing the metabolic rate. So for example, when a body is starving, it decreases the basic metabolic rate to conserve, right? So it hangs on to everything, as well as growth hormone levels to try to conserve energy, limit growth. But with intermittent fasting, we actually see an increase in basic metabolic rate and also in growth hormone. And that explains why diets that advocate for a traditional approach of eat fewer calories and exercise more often fail. Or you may lose weight for that short period of time, but then it all comes roaring back afterwards because the metabolic rate hasn't changed and growth hormone levels haven't changed either. But we have seen a wide variety of studies, whether it's on paleo, ketogenic diets, or even a mixture thereof, and also intermittent fasting, where we can actually starve out cancer cells. Well, we can also see the release of these spike proteins, where it's just kind of a natural evolving process where natural cell apoptosis is being excreted, but also that we have seen these spike proteins release and are then eliminated out of the body. So when we eat in the right order, so for example, we eat greens with fibers, then proteins and fats. And if we're adding starches or fruits, we always maintain that there's a good fiber along with that. Of course, we've also seen in some studies where just as much as 1 teaspoon of apple cider vinegar mixed in anywhere from 8 to 12 ounces of water, and then taken that in before a starchy or a sugar food, actually decreases the amount of glucose that is liberated and then increases the amount of glucose that's flushed out of the body. Of course, anybody who is pregnant should probably not do this because most of the time apple cider vinegar is not pasteurized and we have to be very careful about what is associated with that. But if you don't have access to apple cider vinegar, white vinegar tends to work as well, we just haven't seen as many studies on that. The bottom line is that anytime that we can flatten that curve of blood glucose spikes and valleys, we can decrease inflammation throughout the body and we can increase metabolic rate. That is always helpful because increased blood glucose levels tend to lead to more inflammation in the body. And that's what we're trying to decrease, especially with long COVID and long vax. We've also seen studies, and this has been published in a wide variety of books, that if you eat and then go for a walk afterwards and do that for about 20 minutes or so, you can also help to reduce blood glucose levels. You can also then help strengthen muscle fibers and liberate those nutrients that are necessary for muscles to use. The idea of intermittent fasting where you actually skip breakfast, so you eat dinner is maybe as late as 7 o'clock in the evening, you go all night and then maybe again until noon or so the next day. That again will help release those rapid spikes in glucose. And some people actually find that without that kind of roller coaster ride of blood glucose levels, they tend to sleep better. That's always very helpful. And then when you do break the fast, that's what breakfast is breaking a fast, and you start eating again for that 24-hour period, be very careful to ensure that you're taking in proteins and good fats as well as lots of greens associated with good fibers, and really avoid sugars and starches and even cereals. So it's being hypothesized that perhaps the food pyramid is perhaps upside down, because of what we now know, the starches and sugars are being associated with growing cancers, malignancies, and even sustaining chronic disease, whether it's associated with COVID or not, because elevated blood glucose levels can increase blood sugar levels, increase blood pressure, increase inflammation throughout the body, can certainly slow metabolic rate, can slow thyroid function, et cetera, et cetera, et cetera. And what happens is the body just becomes more and more inflamed. Avoiding snacking throughout the day, so literally limiting yourself to 2 to 3 meals and being careful to ensure that you're getting enough protein, good fat, and lots of greens so that we can decrease the amount of weight. Because one thing that I found that I thought was very interesting is there is a notion that the body will actually cause the adherence to weight and girth to help dilute any toxins that may be in the body. So in other words, the solution to pollution is dilution. And we can see that. Whereas if you have the same amount of toxin in a small vessel versus a large vessel, you're going to see a lesser concentration versus a greater concentration, right? So the body tends to work on that premise as well. So when we're talking about all of these issues associated with long COVID and long vax, whether we're dealing with increased glucose levels or even just finding ways to modulate the immune system, reduce inflammation, including decreasing the pro-inflammatory cytokines, well, what can we do? So these are some pictures of some of the medications that we compound, the different dosage forms that we have available. There are some treatments that we use for symptoms associated with long COVID or long vax, but there's no specific medication protocol or single entities that are FDA approved for the treatment of long COVID or long vax. Most people with long COVID, really their goal is to manage their symptoms so that they can have better quality of life, whether that is decreasing neuralgia, decreasing respiratory issues, being able to sleep better, being able to reduce aches and pains. That is really the goal. But the symptoms associated with long COVID tend to minimize if we are able to decrease those symptoms. So low dose naltrexone. So naltrexone as an entity was FDA approved back in 1964. So we're looking at 60 years of this medication. And it is really one of the most well-studied medications on the planet, really. So to date, so in 2024, we've now seen anywhere from 930 to 950 published scientific studies and case modules on low dose naltrexone, whether that is anywhere from 1.5 to 4.5 milligram or very low dose, which is 25 micrograms to 250 micrograms, or ultra low dose, which is literally 1 to 2 micrograms. We've seen so many different studies being published that in 2017, there were some individuals at Dartmouth University that decided to group these studies based on disease state. And that published paper is very easy to read, but it really helps to hone in on that. And really what we need is an update to that, because since 2017, we've seen probably close to 100 more studies published. So we could very easily add new categories as well as add to those lists that are already there. What we know about low-dose naltrexone is as a mechanism of action, it does block toll-like receptor 4, 9, and 10, which is associated with inflammation and itching as well as immune studies. What we know is that it reduces inflammation associated with chronic symptoms following COVID-19 by reducing interleukin-6 and other cytokines. So interleukin-6 was brought to our attention very early on as one of the pro-inflammatory cytokines that was involved in the infiltration of fluids into the lung spaces with the spike proteins triggering the inflammation. Well, we know that low-dose naltrexone actually blocks that process, so we can actually see inflammation reducing even with spike proteins being present. But we also know that low-dose naltrexone helps to modulate the immune system. It doesn't cure anything, but what it does is it literally forces the body to kind of act more appropriately on its natural pathways. But we also know that low-dose naltrexone will bind to the opiate growth receptor and opiate growth factor receptor, and therefore can shrink tumors. So if we do have tumors associated with inflammation, whether they are even a malignancy or not, low-dose naltrexone can help block that. And we have a wide variety of studies that show that. We have a wide variety of MRI that shows even masses in lung or even in the brain reduced after the use of low-dose naltrexone. We know that low-dose naltrexone is low risk. It has very few side effects. It has very few drug interactions, and it works well with most other treatments. So when we're dealing with long COVID and long vax, we see ivermectin come up in a wide variety of studies, methylene blue, as well as a wide variety of over-the-counter supplements, professional supplements. So let's talk a little bit about that. So methylene blue has been around for well over 100 years, maybe even closer to 140 years or so. So it's been widely used in the textile industry. It is a dye. You can find different forms of methylene blue out there in the commercial space. You can find it on Amazon. But is it clean enough for human consumption? So that's the thing, is that Methylene blue comes with a wide variety of toxins, and we have to be very, very careful because we don't want to cause more harm to the body than what we're trying to get rid of. Methylene blue has been used as an antidote for cyanide poisoning. We know that it's been used as a diagnostic marker for oral cancers as well as breast cancers. And what it does is it helps to inhibit that superoxide anion formation by blocking the xanthine oxidase pathway, the nitric oxide formation by directly inhibiting nitric oxide synthase, and cytokine production by attenuating NF-kappa beta pathways. So, and then ultimately inhibiting both those free radicals and the cytokines and the cytokine production. So both free radicals and cytokines cause inflammation. And those free radicals a lot of times are the oxide formation that is directly correlated to chronic organ damage, but also chronic inflammation that can raise blood pressure, that can then lead to even some cancers being formed, because we know that free radicals have a very direct pathway toward cancer formation. And when you have a lot of cytokines running around, you're going to have more inflammation, more sugar and blood glucose being brought into that area. And perhaps that's what the cancers are feeding off of. That is a hypothesis. With methylene blue, we usually keep the dosing under 2 milligrams per kilo. So usually 1 to 2 milligrams per kilo of body weight. And they're compounded to meet individual needs. So whether we're using a capsule or a liquid, those are very easily compounded. Now, methylene blue is not a clean drug, not only because of some of the toxins associated with the element itself, but it also carries a wide variety of drug interactions. And we have to be very careful about serotonin syndrome. So whether we're talking about SSRIs, SNRIs, monoamine oxidase inhibitors, there's a wide variety of other medications as well that can cause serotonin syndrome all into themselves. But when you add another therapy such as methylene blue, we have to be very, very careful, and we need to inform patients as to what the side effects are associated with that, so that if those symptoms do crop up, that they can seek medical advice very, very quickly. We can almost always count on methylene blue causing green urine. So that is another thing that we need to warn people about so that they don't get super excited and concerned. And sometimes it will actually change the whites of the eyes, the sclera, to be a light blue color. It can be combined in the same dosage unit with low-dose naltrexone. So that is often a really great way to enhance compliance, but also to get after some of those symptoms associated, especially with long COVID, by more than one mechanism. So we've heard about ivermectin on and off for the last 4 years. It's actually been around for a really long time. And it's been very, very helpful in so many different types of infectious disease across the globe. But what we do know is we have some retrospective study, some of which have been done without bias. And what I mean by that is they were literally just poll-like studies. So they just captured data. They weren't necessarily looking for specific patient subsets. They were just looking at a general population and collecting data. The World Health Organization has listed ivermectin as an essential medication. It's been given in more than 4 billion times worldwide. To date, there's over 98 studies from over 1,000 scientists, including upwards of 135,000 patients in 27 countries looking at the benefits of ivermectin. And that's both as an anti-infective, antiparasitic, antiviral. This is more compelling evidence that ivermectin has been helpful in COVID-19, not only in the acute disease state, but also as a preventative medication, and is certainly being used in long COVID syndrome at this point. It has a very good safety profile in various infections over decades, literally decades, with very few drug interactions and very few side effects. It can be compounded into patient-specific dosage forms. It is commercially available in a 3 milligram capsule as well as a topical cream. But sometimes people are not wanting to take a handful of 3 milligram tablets, so we can literally compound it into one capsule or one dosage form for that individual. Again, increases compliance. And anytime that we can do that, I think it makes for better patient outcomes. So some of the supplements that we've seen in the literature, but we also just have really good data on is berberine, for example. So we know that berberine in a dose of about 600 milligrams, anywhere from once to twice a day, helps with insulin resistance. So that's usually taken before a meal. So some people have a larger meal in the morning and an even bigger meal in the evening. So you definitely want to combine berberine with that. It'll help with not only metabolic syndrome, but helps to even out those blood glucose levels. Melatonin has been very helpful, not only for getting people to sleep and keeping them asleep, but it's also an immune modulator. And we have seen its role in bone density studies as well. Melatonin is available in an immediate release capsule tablet, as well as a liquid, as well as a sublingual liposomal spray. And it is available in a long-acting product as well. So some studies are showing anywhere from 1 to 3 to 5 milligram. Other studies are using anywhere from 5 to 20 milligrams. So it just really depends on what studies you're looking at and really what your end goal is with melatonin. We can even test to see when melatonin is higher or lower in a human body so that we can dose appropriately with that too. Because what we find is that sometimes people aren't sleeping well because their melatonin spikes much earlier in the day and they don't have enough melatonin at bedtime. So giving it at bedtime does help with sleep in the majority of those individuals. We know melatonin works really well with vitamin D as well. So magnesium is available in a wide variety of salt forms. We see it over the counter as a magnesium chloride, magnesium oxide. Magnesium oxide is often used as a great stool softener. It really helps with constipation. But when we're looking at other salt forms like glycinate, malleate, but the L-threonate form tends to help protect the brain, especially from Alzheimer's. And the L-threonate form tends to also be used a little bit more for muscle issues, as is magnesium glycinate. Resveratrol is a polyphenol that has antioxidant-like effects. It also is calming in a wide variety of very stressful situations. So lubrikinase is one of those medications that we don't hear a lot about, but it does help thin the blood. So it has fibrinolytic properties. It's associated with cognitive and cardiovascular health benefit profiles, whereas nattokinase is very similar to lumbrokinase. Omega-3, again, great antioxidant, has anti-inflammatory processes. It also helps to lubricate those joints. Probiotics promote digestion, gut health, and also cognitive health because we know that the gut produces, when it's healthy, good medium chain fatty acids, which is brain food. So anytime that we can promote the health of the gut, that will also help. Oh, and by the way, low-dose naltrexone has been shown in some studies to actually tighten the junctions between the cells that line the gut. So again, you're going to have less leaky gut syndrome and better overall gut health with the use of low-dose naltrexone. And we have seen that because it binds to the very specific receptors that are in the gut. You know, because the gut is only one layer thick, right? So the lining of the GI tract is only one cell layer thick. So that's anytime you have weakening in there, you're going to have even just normal metabolites escape the gut and go into the periphery. And sometimes it lands on the skin. Sometimes it will land in other organs as well. Nigella sativa is also called black cumin seed. It's used as a preventative and also to help with acute symptoms associated with COVID-19, primarily as an antioxidant, anti-inflammatory. Vitamin D3, again, available over the counter in a wide variety of dosage forms. Very easy to do a blood test to see where somebody's level is at. A lot of studies are showing that optimal levels of vitamin D are 70 and above, and above 100, there's some reported issues associated with that level. But with vitamin D, we're going to see better cardiovascular health, better bone health, and overall sense of well-being. This is a wide variety of my reference lists as well. The references actually got to be about 3 or 4 pages long, so I tried to shorten that up. But the one thing I wanted to add is about patient outcomes, and any time that we can follow up with patients to ensure that they're being listened to, they're being heard, we're going to see better outcomes, and we're going to be able to track that data and then really evaluate what is going on and perhaps being able to put together better protocols. One type product that I'm currently looking into is called Outcome MD, and that's a subscription that allows medical providers as well as pharmacies to capture data. And it literally sends an electronic link to the patient. This list of questions is derived from FDA-approved PROs, and that questionnaire is answered by the patient. It takes maybe a minute or so to do that, and then the patient sees a score, and then that data is transmitted back to the dashboard where the subscriber can then gather that, scrub it however they want. And then you can also ask the patient to take a look at the same list of questions at specific time intervals. So maybe 4 to 6 weeks later, maybe 4 months down the line, et cetera. And then they can literally see on a gauge how well they're doing. So there's a wide variety of subscription levels that are available on Outcome MD, and it just seems to be a really good platform by which the subscriber owns the data. And like I said, it can be scrubbed. So you can remove the very specific patient identifiers and then use that for additional case study, but also then to really see what is working and perhaps what is not working as well. So I encourage everyone to look into that. If you have any questions, you're certainly welcome to get a hold of me. I'm known as the LDN Pharmacist. These are my 2 social media handles, as well as contact me via my email. This is my personal cell as well. You can also instant message me and be more than happy to help. These are the pharmacies that I'm currently associated with. It's an amazing network of pharmacies and pharmacists. So if you ever have questions, please reach out to any one of us, and we'd be more than happy to get a hold of you. You can certainly find the clinical team at info@RevCustomRx, and you can see us on our website as well. And I thank you very much for watching today. Good luck to you. And if you have any questions, please feel free to reach out. Take care.